Good afternoon. We are here to talk about an emerging danger to mothers, pregnant mothers in Mandera County. A situation of severe anemia among pregnant women that is related to drought-induced malnutrition. A silent but dangerous situation of severe anemia among pregnant and lactating women is unfolding in Mandera County. Data from health facilities is painting a gloomy picture of moderate to severe anemia, especially of pregnant women who present to health facilities for delivery. The current prolonged drought, which is the worst in 40 years, has adversely affected the pastoral community livelihoods. Moderate to severe malnutrition with consequent anemia related to drought is now a cause of detrimental maternal outcomes during labor. This is compounded by poor antenatal clinic attendance among pastoral communities who tend to migrate from one point to another with their livestock in search of pasture. The situation has also not spared the urban poor, and presenting with anemia, severe anemia in labor, compounds the possibility of bleeding after delivery, what we call postpartum hemorrhage. The risk becomes exponentially higher when mothers require operative delivery. Mothers with moderate to severe anemia in Mandera County and who are presenting to labor or during delivery or in labor are at a greater risk of dying from postpartum hemorrhage. And therefore, the axis of severe current drought, maternal malnutrition, severe anemia, and PPH is now what is emerging as a threat to life. I want to give a disaggregated data of malnutrition and anemia among mothers presenting for delivery. The trend towards malnutrition among pregnant mothers has been increasing from June this year. In June this year, 921 pregnant mothers were treated for malnutrition in Mandera County in various hospitals. In July, it was 923. In August, it is 1,037. In September, it is 2,479. In October, it is 2,204. This therefore shows an increased trend in the number of mothers, pregnant and lactating mothers, presenting with moderate to severe malnutrition. In terms of anemia, in Mandera West Sub-County, we had, just for this October, last October, we've had 4 mothers presenting with severe anemia in pregnancy coming for delivery. In Mandera East and largely Mandera County Referral Hospital, we have had 34 mothers with moderate to severe anemia coming for delivery. In Kutulo, the number is 52. In Mandera North, the number is 12. In Banisa Sub-County, the number is 50. In Mandera South, the number is 6. In Lafe, the number is 80. When you add up these cases in terms of the numbers, it comes to about 202. I want to give 3 cases of mothers who have presented in detrimental situation of severe anemia and presenting for delivery, just to highlight the situation as it is. Case number 1. Mrs. S is a 19-year-old female at 32 weeks gestation from the bordering town of Sade in Ethiopia. This is in Mandera North. She has attended 2 antenatal clinics on the Kenyan side, was put on IFAS from the first ANC. At the second antenatal clinic, she was noted to have a HB of 3, and she was referred to Ramu Sub-County Hospital for emergency transfusion. The source of livelihood is pastoralism, and the husband is a poor person. The family had no relatives in Ramu, and because of severe anemia of 3, HB of 3, it necessitated a situation where health personnel at Ramu Sub-County Hospital had to donate blood. So 3 of the healthcare workers had to donate 1 unit each to save this mother. Case number 2, Mrs. H is gravid with her 8th child. She is a pastoralist, and the husband is also married to a second wife. She came with severe anemia, delivered at the facility, and was found. After delivery, she also presented with postpartum hemorrhage and was subsequently referred from the primary health facility to Ramu Sub-County Hospital. At presentation, she had a HB of 4 grams per deciliter, which is a threat to life. She was stabilized and transfused 3 units of blood. Nutritional support was given, and she is currently out of danger. Case number 3, Mrs. G is a 27-year-old pregnant mother expecting her 5th child. She is a pastoralist and has never attended any antenatal clinic due to the drought situation and her constant movement from one area to another to ensure her herd survival. She developed eclamptic convulsions, and therefore she also had severe PET. She developed convulsions, was referred to Mandera County Referral Hospital by the county ambulance in an unconscious state and in respiratory distress. At MCRH, assessment by a team of multi-speciality was done. The mother was noted to be in critical condition. She had twin gestation, that is, she was carrying twins. She had moderate anemia, low platelets, very high blood pressure of 186 over 116, and was fitting and was not in labor. So here is a mother at a term with twin gestation, never attended any antenatal clinic, presenting with severe anemia, eclampsia, on top of every other thing. And therefore emergency intervention and stabilization was done. Blood works, including grouping and cross-matching, done. She was safely operated by a team of doctors. 2 live twins were extracted, are in fair general condition, and the mother was admitted to intensive care unit at MCRH and placed on life support. Today is her 3rd postoperative day, and she is responding well to care, although she still remains critically ill. From the foregoing, it is now very clear that the situation of drought with resultant malnutrition is now posing a great danger to maternal life during delivery. As a ministry, we want to urge on a few things. Number 1, we want all fathers, men whose wives are pregnant, fathers and brothers whose sisters are expectant, to take responsibility and get involved in antenatal care visits by pregnant mothers, so that then any complication or any problem that arises is known and solved at that point in time, well before delivery. 2, all pregnant mothers are encouraged not to skip any antenatal clinic visit, so that then again, a second time, problems are identified early enough. Finally, partner support is more urgently required now than ever for pregnant women in Mandera County. We call for emergency support for pregnant women and lactating mothers on top of the children that we have highlighted previously. In terms of availing supplementary feeds at all antenatal visits for pregnant mothers, these supplementary feeds include CSB, which is a special porridge, Mama Light, Lipto Mama, and others that are available. The health staff will keep on supplementing IFAS, but IFAS will not replace necessary food that a mother requires. Thank you very much.